Live. Let's see. All right. Good morning, good afternoon, good evening, depending on when you're watching this video. This is the voice and face of Dr. Tolope Olabintan of Living Spring Family Medical Center here in Mansfield, Texas, where we help our patients live long and well because we believe the quantity of life or the quality of life is just as important as the quantity of life. I'm excited to be here again, doing another live. This is the first for the year 2022. And I'm happy to be, not to have our guest, Dr. Okwe Danion, here with us. She is an otolaryngologist, a head and neck surgeon. I'm going to let her introduce herself, but I'm really happy to have her here because we're discussing the topic ENT, ear, nose, and throat issues with the ENT doc. We'll be talking about specifically sinuses. So without further ado, I'm going to hand it over to you, Dr. Danion. Thank you for being here. Please introduce yourself. Who are you and what do you do?
Sure. Thank you so much, Dr. Olabintan, for having me over. My name is Otolaryngologist Mannion, just like Dr. Olabintan said. I am an ear, nose, and throat surgeon, and so people know us as ENTs, otolaryngologists, surgeons. So basically, we treat children and adults with disorders of the head and neck. I treat patients medically as well as surgically. So I see patients in the clinic and also do surgeries in the operating room. So some complaints that patients come to us with is ear pain, hearing loss, sinus issues, difficulty breathing through the nose, thyroid issues, head and neck cancers. So we see a variety of things.
Interesting. So there you have it. An otolaryngologist, head and neck issues. Essentially, you do the whole gamut. So awesome. Now, our next question is this though: why do you do what you do? And I always like to ask the question just to kind of get an idea into like what was your thought process? How did you become what you are right now? If you don't mind briefly letting our guests know.
Sure. So why do I do what I do? First and foremost, I love surgery. And ENT is a surgical subspecialty. So in med school, I rotated on different surgical subspecialties and fell in love with ENT. It was just a great fit. I got along with the people. I really love the variety. So like I said, we do a lot. It's a small space, but there's a lot in there. And the fact that it's children and adults, and also we have the opportunity to really improve people's quality of life. And so that makes me happy, and that keeps me doing what I'm doing.
All right, awesome. You love it. Hey, that's beautiful. Where you can combine your passions as a way, also to make a living. That's awesome. So you obviously enjoy what you do, so that's great, and I'm happy for you. That's very important in life. So our first question, our focus is sinuses. All right, we talk about sinuses a lot. I see a lot of patients. Oh, I have sinus headache. I have sinus congestion. But what are sinuses? What are sinuses?
Great question.
And how do they get, sorry, and how do they get clogged?
Okay, perfect. So this is a great question, especially this time of year. The sinuses are air-filled spaces in the bones of our face and skull. So we have sinuses behind our cheeks, in between our eyes, behind our foreheads, and also behind our noses. The sinuses have lots of functions, but most importantly, they produce mucus, which helps to moisten our nose and also to protect the nose from things that we don't want in there. So the mucus traps things like dirt, dust, pollen, viruses, bacteria, fungus. So it traps those things, and those things are then swept to the back of the throat, to the back of the nose, and then down our throat, or we sneeze them out. The sinuses, the lining of the sinuses, the tissue in the sinuses, also helps to filter the air that we breathe in and humidify the air. So basically, those things listed, the dust, the pollen, the viruses, things like that, when they enter our nose, they can cause inflammation or swelling of the tissue of our noses. And that can cause lots of like drainage, the mucus that comes out of our nose, and it can cause that drainage to become thick. It can cause things like sneezing. And so basically the sinuses have openings that connect it to the nose. So when those openings become swollen by all these irritants that enter our nose, the sinuses can't drain the mucus into the nose. So basically the mucus gets trapped in the sinuses, and that's what makes them clogged. And so when mucus is trapped in the sinuses, that can give us a sensation of pressure, it can give us a headache. That mucus can then get infected because bacteria likes to grow in, mucus that's just sitting there. And when it gets infected, that's when the mucus can turn green, fevers, it can turn into a sinus infection.
Okay, awesome. So a lot of points you mentioned there. Ideally, the sinuses are supposed to air filled, right? They're supposed to be empty, but they serve to help with filtering dust and irritants away from us. And over time, they can get congested, they can get inflamed, and that's where you get a lot of the symptoms of the sinus pressure, the sinus headaches. But they're there as a preventive measure. But sometimes they can get a little agitated. Now, that being said, what are some of the common causes of sinus problems that you see in your office?
Sure. So sometimes it's the upper respiratory infection, colds that go wrong. Sometimes allergies. Allergies are a huge thing, especially in Texas. People are allergic to cedar and different grasses, and dogs and cats and dust and things like that. And that can cause inflammation and then congested sinuses. Some less common things that are interesting are things like polyps. And a polyp is a benign, meaning not bad, not cancerous nasal mass. It's just inflammation gone crazy. So sometimes things can grow in the nose and obstruct or clog the sinuses. Other things can be people who have immune problems, so they're not able to fight bacteria and fungus effectively, and so they get lots of sinus issues. But I would say definitely the colds, the upper respiratory infections, allergies are the main things that cause our sinus issues.
Okay. Now you mentioned there's some things that are, I guess, preventable, and there's some they're not. Of course, in this season of COVID is one of the causes of the upper respiratory infection-like symptoms. Now, from your point of view, what are ways to prevent some of the sinus congestion or sinus issues that you've highlighted? Of course, the ones that we have control over and the ones that we don't. But what are preventive measures that one can take to prevent sinus issues?
Great question. So just like you mentioned, in this era of COVID, we're kind of learning things that help to prevent, upper respiratory infections in general. So things like washing hands, wearing a mask, especially around people who are sick. Those things can go a long way. Then for people who have allergies, if you notice that you start sneezing or getting a reaction when you're dogs around lots of dogs outside, it's important to be aware of the things that trigger those reactions and then avoid them. And that can also look like making sure you disinfect regularly, use high filtering air systems in your house. Getting allergy tested if needed, and you could talk to your primary care doctor or an ENT about that. And then specifically for treating sinus disease, things that are really helpful to do at home is flushing your sinuses out with salt water.
So that's the nasal saline rinses, right? The irrigation.
The irrigations, not just the spray, but an actual flush where you're squeezing salt water up one side of the nose and it comes out the other side. That's very helpful in cleaning out thick mucus, cleaning out any dust and dirt and allergens or bacteria or viruses that could be in the nose. And then also using a nasal spray, a steroid nasal spray. I'm sure people have heard of Flonase. That is Flonase and the nasal saline irrigations are really good at preventing chronic sinus disease. And the saline method, so there are lots of
Before you go ahead, a lot of patients tell me this, doc, I don't like the feeling of the irrigation off my nose. Sometimes they say, I have patients say they feel like they're drowning.
right.
But even having conversations with ENTs over the years, the recommendation is to keep doing that as a preventive measure. Do you have any tips for anyone who's probably asking, like, doc, you don't know how it feels? It doesn't feel good.
Sure.
Is there a way to do it that would make it less traumatizing?
Great question. So yeah, there are some tips. First of all, making sure that you're using either distilled water or boiling water and letting it room temperature is important. Making sure the water is lukewarm, so not too cold, not too hot. Um, there are several ways to administer the salt water in your nose. So I think there's the squeezy bottles, Neomed sinus rinses that I really like. There's a neti pot. There's something called a sinugator where you just hit your button and it squirts the water through. There's something called the Navage, which is a new thing that a lot of people are asking me about. It's basically a machine that delivers the water in your nose and it actually recycles it back into the machine. It doesn't go back into your nose, but it's one closed system. So I think it's important if one way, if you don't like one way, try another way because there's so many. Also, I always tell my patients to make sure you bend your head over the sink, so that when you're squeezing the water, it's not going to get down your throat and it'll just come out the other side of your nose. Another thing I tell patients to say that it feels like the water is getting in their ears. If you say "caw" while you're squeezing up the water, that helps to close off the connection to the ears, and that can help prevent.
You say what? Ha.
Caw with K. K-A. Caw.
Ha. All right.
I tell them to try
this. Awesome. So very helpful tips. Thank you. Now you were saying also irrigation. You said allergy testing. Finding out if you're allergic to something in the atmosphere or in the environment that you may need to avoid, or getting allergy shots as well. That could also help with minimizing the swelling that can contribute to the sinus congestions. Now, I was going to ask now, what home remedies would you discourage? Like, what have you, based on your experience, like what are the things people have tried that you would say is a no?
Great question. So I don't think I've heard of any crazy home remedies. You can let me know if you have. However, there are some over-the-counter medications that lots of patients use regularly that I discourage. One of them is Afrin.
Afrin, and I knew that was going to
which
be
is a decongestant nasal spray. People also use Sudafed daily. So I discourage using decongestants daily because they can cause something called rebound congestion. So the congestion might go away temporarily, but it then comes back and it's even worse. So I tell patients to avoid using decongestants for more than 3 days. I mean, decongestants have their place. Like if someone has an acute infection or severe congestion, they can't breathe at all. Sure, use it, but don't use it for more than 3 days because then it can become addicting and then cause that rebound congestion. So that's, I think, the number one thing that I see. I see patients who are like, yeah, I use 5 times a day for 3 years, and I have to literally wean them off of it. And then another thing that I discourage is it's not a treatment, but it's an idea. People always assume that any pain in the face or the head is a sinuses, and it might not be. Obviously, it's important to go to your doctor and get evaluated for sinus disease. But if you've been on all the medications, all the irrigations, and you're still having pain, it's time to think of other possible causes. And migraines are a very common cause of sinus headaches. So just keeping an open mind.
Okay. All right. I like that you mentioned one has to be very careful with over-the-counter medications. And of course, this is a conversation you should have with your primary care doctor, your ENT doctor as well. It's individualized. This does not serve as specific medical advice, but really important for you to have a conversation with your primary care doctor and your specialist as needed. But very, very cautious with the use of decongestants, especially Afrin. And decongestants can also raise your blood pressure. So very, very, very important. And I cannot overemphasize the importance of nasal irrigations. I tend to encourage those who tend to have sinus issues to do that preventively, not just when you feel miserable, when you feel super congested. I think it's a good preventive habit to have. All right. My next question. So I had this question from a patient. It said, I have frequent sinus congestion and runny nose. My grandmother has had similar issues and was diagnosed with a nasal polyp. Could I have it too? What do you think, Doc?
So it's possible, but obviously it's going to be important for you to come get evaluated by an ear, nose, and throat doctor, because congestion and runny nose can be caused by so many things. Like we discussed, it can be caused by allergies. It can be caused by chronic sinusitis. And so with patients who have chronic sinusitis, they have these symptoms of the sinus headaches, the headache, for more than like 12 weeks at a time. Sometimes these patients need to be put on antibiotics in addition to the nasal irrigation and the steroid nasal spray. So it's important to come in and get evaluated. Another thing is that polyps can also be associated with other symptoms such as loss of sense of smell and severe obstruction or difficulty breathing through one side of the nose, really thick yellow-green drainage. So with polyps, it's not necessarily just the runny nose. They could have those other symptoms associated with it. But what I would do if a patient like this came to clinic, I would actually use a small camera to put it in the nose, and that would be able to tell whether there really are polyps inside the nose. If I don't see polyps, it's still possible that there could be polyps that could be stuck in the sinus, which I can't see through that camera. So at that point, I would have to get a CT scan, which is pretty much like a super X-ray, and that would be able to show me whether there are polyps in the sinus. So yeah, it could be polyps, but it might not be. So it's important to get checked out, get a scope in the nose, and go from there.
All right, awesome. I have one more question. So this I get a lot. Doc, I have sinus. I think I have a sinus infection. I need antibiotics. I'm draining green discharge from my nose. It was yellow, then it was clear, then it was green. So I think now that it's green, it's really a bacterial infection and I need antibiotics. I think I kind of want you to speak on that a little bit, because sometimes it's hard convincing patients that may not necessarily be a bacterial infection that requires an antibiotic. But what are your thoughts on the color?
I mean, in my experience, by the time it gets to green, it is a bacterial infection. And a lot of times I end up, because it's so easy for me to look into the nose with my finger, sometimes I end up taking of that drainage, and then that can tell me for sure that it is a bacterial infection. But usually it's not just the green drainage, it would be the pressure, it might be a low-grade fever, it might be loss of sense of smell. And then, of course, with sinusitis, usually we say that if it's been 5 days, it probably hasn't gotten to a bacterial infection yet. But if it starts getting worse, or it got better and then it gets worse, and then by 7 to 10 days, the symptoms are still pretty significant, then yeah, it's probably a bacterial infection. So usually we say that viral infections are most short-lived. When it's starting to pass the 5 day, 7 day mark, and they're still having that discolored drainage, then yes.
Okay, so it's much more. So it's much more than the color. It's other symptoms and the duration as well.
Yes.
And one has to be very careful with antibiotic use. And so
Yeah.
when those conversations are had, it's definitely easier to just prescribe medicine, but sometimes it's more to prevent the risk of antibiotic resistance. So we want to make sure the antibiotics will work when they're in fact needed.
Exactly.
Awesome. This is very, very good. This has been very helpful. I appreciate you, Dr. Danion, for coming on. Now, I have people who are looking and who are saying, this doc is awesome. I need to see an ENT. I need to know where to find her so I can get my primary care doctor to refer her. Now, where can people find you?
Sure. So I am located in the Professional One building, right next door to the new Texas Health Hospital Mansfield on Lone Star Road in Mansfield. It's right in between 360 and 387. So I would love to see you. My address is 2302 Lone Star Road, Suite 220. So I'm on the second floor in Mansfield, Texas. Is there an area where I can get a telephone number?
Oh, yes. Yeah, so after the live is done, I'm going to put that information. And you could do so too on the Facebook page. And you could tag. I also put your Facebook handle there as well for your business. So that way people know where to reach out to you. Okay.
Thank you so much.
Thank you so much for coming. It's been awesome. I've learned a lot of things to help my patients also feel better. I look forward to doing this again with you. I will let you know when. But thank you so much for coming. And thanks to those who are watching with us. Thank you for watching. If you're watching this live, if you're watching this on replay, please make sure you share with those who you find who would find this actually useful, especially during this time. That being said, it's been a pleasure. This is the voice of Dr. Olabintan. If you or anyone you know is looking for a family physician who's thorough, who's passionate, and who's caring here in the Mansfield, Texas area, I am she. Have a good one. Thank you.
Thank you.
Thank you.